Hello my beautiful friends and welcome to fibamu. I'm Inga, physiotherapist, and in today's video we'll talk about your sacroiliac joint pain. So firstly, I would like to explain to you a little bit about the anatomy of the SI joint for you to understand better why it is hurting you or what is hurting you, okay? Then we'll do two simple self-assessment tests to check out if it's really the SI joint bothering you or if it could be something else. Then we will do together 3 gentle self-mobilization techniques that will help you relieve the pain immediately. So let's get into it. So the sacroiliac joint is a joint between your sacrum and your 2 iliums, so on the outside of your pelvis, okay? These are connected with what we call sacroiliac ligaments and actually have a very small possibility to move, okay? If we look at the pelvis or the pelvic girdle, we can't forget these bones that are called the pubis. They're in the front, and then you have something very much in the front that we call the symphysis pubis. Just keep that in mind, since if we move something in the back, chances are the front is also out of alignment, okay? Another thing I would like to highlight is that the sacroiliac joint, or the SI joint, is the one orthopedic joint that connects your upper body to your lower body. On top of the sacrum comes your spine, right? So there's a lot of weight bearing and force on the SI joint. Causes for SI joint pain, discomfort and dysfunction can be, for example, a trauma if you had like a car accident or you fell and really got something out of alignment. Could also be obesity, arthritis, and of course also pregnancy. But pregnancy is a very large and a little bit different topic since hormones are at work and it's just a different kind of complexity. But if this is something that interests you, just leave me a comment down below and I can make a dedicated video on SI joint during pregnancy. But now let's look at the common symptoms of SI joint pain. Common symptoms with SI joint pain is pain on your buttocks area. Also, the pain is relatively sharp. You're experiencing it after long periods of sitting. Let's say you've been driving in your car, getting out, and this is your SI joint pain. Or also if you do one-legged exercises, or it doesn't have to be an exercise, but for example, if you're walking up the stairs, this is one-sided, you're feeling the pain increase, and as well, laying on that side might worsen your pain. So what can we do and what should we do? Well, firstly, we should bring everything back into proper alignment. So if something is out of alignment, we should bring it back into alignment, and we'll do that just now. And then really, really important, you want to strengthen. You want to strengthen the muscles around your pelvis, also your core muscles, your gluteus muscles, to really make sure that everything stays where it's meant to be, okay? But I made a different video on the strengthening for SI joint pain, which I will link down in the description. And now we'll get into the self-assessment. All right, so our first test is called the Faber Test. It's also known as a Patrick's test or the Figure 4 test. For that test, please come lay on your back, okay? I'm going to demonstrate it with my left leg. You're going to stretch out your legs, relaxed first, and then you're going to take one leg and place the ankle on top of your knee of the opposite leg. If that makes sense, and you can see that. Okay, and then you're just going to let gravity do its work, let the knee go down, and pay attention to the opposite side not coming up. So you don't want your butt to come up, you want this side to stay down and this knee to drop lower than the opposite thigh, okay? So a positive test is when you can't drop lower, so your knee is stuck somewhere up here. And another sign for a positive test is that your pain is getting worse, okay? So this is recreating your pain. The only problem with this test is that it could also be indicating a hip problem. So we want to do a second test to make sure this is not just a hip issue, but really the SI joint. For that, you can stand or you can also sit, and you're gonna take your thumbs and place them around the area of the dimples of your back, okay? So basically where the ilium meets the sacrum, and if you push here, and this is again making it more painful, then we have another sign or positive test that this is really SI joint involvement, okay? If these two tests didn't provoke any pain and you have any additional symptoms, let's say you have a tingling sensation down your leg or you have some weakness in your leg, just keep in mind that it could also be something else, let's say a lumbar disc herniation, or if you feel like some warmth in the area, it could also be a hip bursitis. So make sure you see a local professional to have it checked out. But if it is a true SI joint pain, let's do some self-mobilization for it. Again, please come lie on your back. The first thing you're going to do is bring your knees up in a 90-degree angle. Okay? Now take your left hand and place it on the thigh of your left leg, and take your right hand and place it on the hamstrings, on the back of your right leg. Okay? You're going to work in opposite directions. So you want to both times push your hands away or bring force into your hands. So you're pushing and pulling at the same time, okay? In opposite directions. Really as strongly as you can. Hold it for a moment and release, okay? Repeat it 3 times. Hold it for about 5 seconds each time. Pause. Let's do it one more time. And pause. Very good. You can also repeat it on the other side if you like. Let's do it together. So you push and pull at the same time. Relax. Do it again. Relax. One last time. And relax. Very good. Release your legs down. And now you're going to try first to bring the legs outwards, exaggerate it, and then inwards, okay? But again, you're going to resist yourself. Or you're going to place your hands on your thighs, push outwards, trying to push your hands away. Pause and put your fists between your thighs and push inward, okay? Often if you have a problem already, here you feel a little pop or a little noise can be created. Again, let's do it 3 times. And inwards, push, push, push. Very good. One more time outwards. And push, push, push. Very good. And pause. For the last one, you're going to take one leg up in the air again in a 90-degree angle, and you're going to do an internal and external rotation of your hip. So we're going first out and then in, and you guessed it, you're trying to resist again and pushing against your hand, and then inwards. Very good. Another time outside. And push and resist on the inside. One last time. Very good. Let's do it on the other leg. Very good. Release your leg, slowly come up over the side. So that was it. I hope it was helpful. I hope you could release the pain with these exercises or with these mobilization techniques. And if you are looking for exercises strengthening, as I said, please make sure to look at the video. I'll try to also link it here or there. And then if you like this video, as usual, please give us a thumbs up. Make sure to subscribe to our channel, and I hope to see you here again soon. Goodbye.